Vaccines protect us from serious and potentially deadly diseases. So a vaccine is made from very small amounts of weak or dead viruses that are either killed or weakened to the point where they don't make you sick. They contain the same virus that causes a certain disease. A vaccine stimulates your immune system to produce antibodies similar to how your immune system would if you're exposed to the disease. Antibodies are proteins that help you fight off infections and can provide protection against getting that disease again. After getting vaccinated, you develop immunity to that disease without having to get the disease first. So unlike most medicines which treat or cure diseases, vaccines prevent them. So like eating healthy foods, exercising, and getting regular checkups at the doctor, vaccines play a vital role in keeping us healthy.
Influenza, or the flu, is a virus that can cause serious damage, leading to hundreds of thousands of hospitalizations and tens of thousands of deaths each year. Every flu season is different, and the response to the virus varies with each person, which is why it's important to get the annual vaccine.
There are many risks to not receiving the flu vaccination. The flu shot is necessary to protect yourself and those around you from being infected with influenza. The virus can be spread before the individual knows they have it. If you do not get the vaccine, you will have a much higher chance of being hospitalized for the flu and flu-related symptoms, especially if you also have certain medical conditions. Also, the severity of the virus is much worse without the vaccination.
There have been a lot of myths regarding the flu vaccine. For example, we always hear, "I'm not getting the flu shot, it'll give me the flu." But we're here to tell you that is actually a myth. Put it simply, every vaccine contains the virus it causes. In the flu shot, the virus contained in the vaccine is killed. This means that the virus cannot in any way give you the flu. However, depending on the person, the vaccine may cause some side effects. These are rare, but may include headaches, muscle aches, and a low-grade fever that lasts no longer than 1 to 2 days. These are the symptoms many people mistake for the flu, but these are simply the body building up the antibody response that protects you from actually contracting the flu.
So we talked a lot about the flu, the myths, the whatnots, but when you should get it? Every October, and it will help you throughout the entire season.
Gardasil protects against human papillomavirus, or HPV. HPV is a sexually transmitted infection that has many strains. Some of these strains may cause genital warts or certain cancers. The HPV vaccine protects against 9 of these strains. You should know that some of the cancers that can be caused by HPV have the potential to impact fertility. So when should you get Gardasil? The Gardasil vaccine has 2 dosing schedules, one for those who start the series before 15 and one for those who start the series after 15. It is recommended that you start the series around 11 to 12 years of age, but you can begin as young as 9 years of age. The vaccine provides better protection if you get it at a younger age. If you begin the series anytime before 15, you only have to receive 2 doses. The second dose will be given 6 to 12 months after the first dose. If you begin the vaccination series after 15, 3 doses are required. The second dose will be given 1 to 2 months after the first dose. The final dose will be given at 6 months after the first dose. If you get off schedule, don't worry. You do not have to repeat any of the vaccines if you miss one.
There are several myths surrounding the HPV vaccination. One myth is that HPV is uncommon, so there is no need to get the vaccination. However, HPV is common, with over 14 million Americans being diagnosed each year. Another myth is that the Gardasil vaccination only protects against a few strains and is not worth getting. While the most common vaccination protects against 9 of the most common strains of HPV. Some believe that the HPV vaccination is unsafe, while in reality the HPV vaccination has been studied and researched for over a decade, and the most common side effects reported with the vaccination are some pain in the injection site, dizziness, nausea, and a headache.
HPV vaccine is available at your doctor's office, local pharmacy, and healthcare clinic. Under normal circumstances, if you're under the age of 18, you must have a prescription and permission from a parent in order to receive the shot at your pharmacy. But during COVID, you're allowed to receive the shot without any prescription necessary as long as you're over the age of 3. Since the vaccine was introduced over 10 years ago, incidences of HPV types that cause most HPV cancers and genital warts have dropped 71%. Research has also shown that the HPV infection rate has decreased 86% in teens between the ages of 14 and 19. The effectiveness of the vaccine has not shown to decrease over time.
Why music therapy is a useful tool for vaccine recipients. Having an aversion to needles is completely natural and understandable. It just so happens that 20 to 50% of adolescents have a needle fear, and 16% of adult patients avoid the influenza vaccine due to fear of needles. What about music therapy makes it useful for this population? Music has been found to reduce pain response and reduce stress and anxiety through the numerous studies and observations. How music therapy lowers stress and anxiety. Music listening has been found to increase dopamine levels in the brain. Studies also suggest that it could increase cortisol levels, which is a hormone that activates in response to perceived stress. It is the right type of music is chosen, such as patient-preferred music or music with lower tempos. The entire body could become aligned, including pulse, blood pressure, and body temperature. These are all bodily functions that are directly affected in the event of stress. How this can help you. Having a fear of needles is normal, but this shouldn't stop anyone from getting vaccines that are important to protect your health. Music therapy is becoming a more popular study within health fields because of the positive ways it affects human health. Though music therapists can't follow everyone to get their vaccines, you can use music therapy techniques during these times. Listening to music that you enjoy and calms your nerves and breathing mindfully with the beat is significantly effective and can be done before or during vaccines.